what I hear you speaking to, and I'm going to kind of refer to my notes from your
Yeah.
paper while I'm saying this, is that, based on what we know about through the psychedelic research and all the different sort of aspects we've come to identify, and these are the things that these psychedelics do in this context, in this brain, and here's the result, that, it's a fair hypothesis that developing a treatment protocol for chronic pain that includes psychedelics might end up being significantly more effective than our current treatment protocols, because they address a number of the aspects of chronic pain simultaneously, on the direct biological level of their impact on the nerve tissue through its impact on serotonin and the perception of pain, but also through psychedelics having, or classical psychedelics having, a direct anti-inflammatory effect, which would, the inflammation is a part of the activation of these nerve cells. And you also said that it'll enhance descending inhibition, so it'll enhance your brain's ability to be like, no, you don't need to fire, like no need for that pain. And it also creates this opportunity where, from the psychological aspect of what we can experience and discover during our psychedelic experiences and whatever therapies and support it, we can have, like CBT can support the efficacy of a gabapentin prescription, we can utilize therapies during psychedelic experiences in order to amplify and reinforce new ways of relating to ourselves and our lives, such that we can maybe not deprioritize, but like sort of take a few step downs, like how prominent the changes in our perception related to chronic pain were. We can put chronic pain far enough down that we can reinforce these other aspects, such that chronic pain can slowly become less and less a part of our default mode network. And this is something that is theoretically reflected in an actual change to the kind of networks in the brain responsible for how we perceive ourselves and our lives. And so in this way, we can address chronic pain on multiple levels, which of course would then change how we show up to the world. We have insights about ourselves and about our pain, about our behavior. That'll change how we behave in the world, which will change how our social world responds to us, which then gets into the social aspect of it. And so there's this one drug, or one class of drugs, can be utilized in a way to target all of these different issues related to chronic pain in a way that actually can make substantial long-term changes that are not dependent upon continued administration of the drug in order to reduce the symptoms of chronic pain. Is that about right?
Yeah, I would say, yes, you're right.